of Explore Tobacco Cessation. Hope everybody's doing good today on this, I was going to say Wednesday, but it's only Tuesday, unfortunately. So hopefully everybody's having a good week so far. Let's get into it. So we're on our third session. Our last session, we talked more about the influence of our habits and really kind of gearing in on those habits that become those triggers for ourselves. And then we talked a little bit more about really putting down your effort onto paper in the form of a quit letter. If you have had a chance to do that, or if that's something that is really motivating to you, please do that. I think it's really powerful, especially when you're in the right frame of mind to want to, put your passion and your emotions onto that paper. But everybody's different. Everybody's at a different phase of their journey, and maybe it makes sense to you now, maybe not. But like I said, I think it's a really powerful tool to reference back when you do need to. So today's session, we're going to get into a little bit more about different quit methods. We'll talk a little bit about medications, including prescription medications as well as over-the-counter medications. And then we're going to talk a little bit about motivation and how to really tap into your motivation and kind of how to re-spur that motivation for yourself. And then we'll talk a little bit about another motivation, which may be inspiring for some of you, the savings and the rewards to quitting. And we'll talk a little bit more about that. All right. So I'm going to go over some of the different quit methods and kind of give you a summary of what they all are, just so you know, so you don't have to write these down. I will be sending everything over to you, and then we'll talk a little bit more about, after I introduce these things to you, I'll talk a little bit more about how to use them, the length of treatment, possible side effects, and how to get them and use them if it's from a doctor, over the counter, and then the cost. So I'm sorry, I won't talk about that today, but I will send that to you. So if something is kind of spurring your interest, I'll give you a little bit more insight to that, so you have that as a reference for yourself moving forward. So let's get into it. So our first set of quit methods are our prescription medications. Now this is something that would be prescribed by your doctor. So if you are at that place of having this discussion with your doctor, which I feel is a really good place to be starting your journey, these are the medications available that they could prescribe to you that would help with the quit process. All right, so the first one is bupropion, also known as Zyban, Wellbutrin, and there's other generic names for it. Bupropion is used to curb and reduce cravings for tobacco use. It does not contain nicotine, which is one of the main reasons why it's appealing for people. And it helps to decrease symptoms of nicotine withdrawal. The next one is a nicotine inhaler. It's a type of inhaler used to replace tobacco products that you can get from the pharmacy. And it's basically a vapor that you breathe into your mouth and your throat. And then the nicotine is released into your bloodstream. The nicotine inhaler can help reduce cravings that you may experience. The next one is varenicline, and the name that may sound a little bit more familiar is Chantix. Some people receive this prescription from their doctor. Basically what it does is it acts on the receptors of the brain to reduce the effects of nicotine. So it's kind of an interesting, different approach to quit method. And then the last one is a nicotine nasal spray. So nasal spray can help curb nicotine withdrawal symptoms and cravings. All right, and then we'll get into the over-the-counter medications. The first one is nicotine gum, and this, once again, can be bought over-the-counter without a prescription. A minimal amount of nicotine is actually absorbed through the membranes of the mouth. And if you do purchase them, it's important to pay close attention to how you utilize or how you use these. It's not necessarily like a chewing gum that you would have. It's kind of you chew on it a little bit and then you let it sit in between your gum and your cheek. So pay attention to the directions if that's the first time you're trying it and using it. Beyond that, the nicotine patch, which is well known as well. Once again, without a prescription, you can purchase these. And basically what you do is you wear one patch over the course of a 24-hour period, and you replace the patch daily. The patch can help decrease the symptoms of withdrawal as well as cravings. And then the last nicotine option is the nicotine lozenge. These lozenges, once again, are available without a prescription. There's only a small amount of nicotine in these lozenges. They're very easy to use and convenient. They release nicotine, which can be absorbed by placing it in your mouth and then basically letting it dissolve. So other quit methods beyond medications is the cold turkey method. That is an option, kind of tapping into what maybe motivates you or what maybe your personality is. This may be a good option for you. Quitting smoking cold turkey can have varying degrees of success and depending on the person. So I think it's a good option, but just kind of know yourself and see if that would be effective for you. Another option is a program that is offered through the American Lung Association called the Freedom from Smoking Program. And it's similar to this setting, and it's a small group setting, but it is, I believe, done in person, and it's an 8-week course, or 8 sessions, I should say, and you really get a lot of attention from not only the facilitator, but also support from your peers as well. So it's kind of nice to be sitting in the same room. I know we just don't have that opportunity in this type of setting, but that is something to consider. The program includes a variety of evidence-based cessation practices, and then it also includes lectures, group discussion, and then skills practice. And the other method I have on this page is the quit lines. So these are good to know for people who are wanting support, assistance, or counseling. If you're thinking about quitting, in the process of quitting, currently in the quit process, or have already quit. So basically all phases of that works. Okay. All right, moving on. So I wanted to talk a little bit more about different types of motivation. So there's basically 2 types of motivation. There's intrinsic motivation and extrinsic motivation. Basically, intrinsic motivation refers to behavior that is driven by internal rewards. So the motivation comes from within yourself, along with the satisfaction of completing the task. So the intrinsic motivation is really essential in establishing a new habit or behavior. And then the other type of motivation is the extrinsic motivation. And this type of motivation refers to participating in behavior in order to earn an external reward or avoid punishment in a sense. So working towards an anticipated reward provides satisfaction that the task itself doesn't provide. So external motivation is good for you to get started on your goals since you're more task-oriented, but then intrinsic motivated works well with kind of keeping up with that internal, I guess, motivation to keep going. So really having a good, I guess, drive from both of these types of motivation can really be the perfect combination to get you moving forward. So a few kind of areas to kind of touch on that. Maybe it's a little too hard to get motivated, or motivation sometimes it's hard to kind of, utilize in this process, is that it's sometimes just hard to get started on something, especially if it's really important to you. It's kind of like, where do I start? How do I get started? Well, kind of, gearing into why you want to do this, kind of, really stemming from the why that we talked a little bit about in our first session. being comfortable. Most people don't like to be uncomfortable, right? They don't like uncomfortable situations. They don't like to feel uncomfortable. So kind of getting yourself into that phase of a comfort place that you know you're not going to be in pain anymore, if that makes sense. And distractions. We live in a world of distractions. We're constantly consumed by way too much, and trying to understand and appreciate the beauty of having and doing less can really be hard to get motivated when you're constantly distracted by what you really want for yourself. Excuses can be detrimental to motivation. Kind of, addressing those excuses and really seeing if it is a barrier or an excuse to help provide you with a step forward. Confusion. Sometimes we just don't know where to go, what to do, how to be productive, how to be motivated. So kind of getting that clear line of thought with your mindset, it will be helpful with motivation. And then just the lack of ambition. Sometimes, people will usually adapt to the goals that they set, but it takes some time and some ambition to get them up and going. All right. So we'll do a little bit of strategies to get you started. So what I like to say with any goal setting is to start small. Set yourself up for success and start small where you feel you can achieve your initial goal and then go from there. Tell people about your goals. Tell your friends, your family, tell them what your plans are and how they can support you moving forward. Practice positive self-talk and self-thinking. I think this is a really beneficial one, especially if we've been down this path before and we haven't had success. Track your progress. How are you going to know if you've succeeded in the short term, with smaller goals? If you don't physically track your progress, writing things down, how can you know that you achieved that goal? Visualize your goals. What's at the end of the road? At the end of the tunnel, at the end of this journey. What do you look like? What's different? What are you looking forward to that you maybe aren't experiencing at this time? Be patient, and once again, focus on small successes and small wins. Seek support. Once again, telling people that you love about your goals is great, but if you need additional support, from the quit line or from other small group settings like this is always available. And get excited. You're doing good things for yourself. You should be really excited about that and know that this is going to be a challenge, but know that you're up for it and you know you can accomplish it. Okay, I will send off this material. Before next time, we're going to talk a little bit, before next time, if you could complete the savings and rewards exercise. I think that will be really inspiring. And then review the What Motivates You handout as well. I think that will really help with the journey that you're about to take. And then next time, we're going to talk a little bit more about the time to quit. So hope you guys are enjoying your day, and we'll talk to you next week.